us Dr. Siraj Mohammad Salim from Iraq, an IMG in Canada, in the process of licensing here. A fantastic doctor who was involved in many activities with us, and he will present a neurological exam to our medical school summer camp. Dr. Siraj?
Thank you for having me. Today I will talk about the carpal tunnel syndrome. It is a physical examination and some definitions about it. Should I start?
Yes.
Okay. What is carpal tunnel syndrome? It's basically the entrapment of the median nerve in the carpal tunnel. Here is the carpal tunnel area between the scaphoid bone in this side and the pisiform bone on this side, and it is over the flexor retinaculum, which is this distal crease you can see right here. Okay, what causes the carpal tunnel syndrome? It might be caused due to osteophyte growth, which is a small bony growth, or diabetes mellitus or rheumatoid arthritis. These all can cause carpal tunnel syndrome. Okay, now let's talk about a physical examination. If a patient comes to you, tells you, I have a pain in my hand in this area and a weird sensation, what you gonna do in this case? First of all, you have to introduce yourself. You tell him, you greet him and introduce yourself and explain to the patient what you are going to do. For example, you tell him, hello, Mr. Jackson, I am Dr. Siraj Mohammad Salim. I am the working physician in the clinic today. I understand that you are here because you are having pain in your hands. For the next few minutes, I'm going to do a physical examination for your hands, and I will need to ask you questions during my exam and do some maneuvers. If you feel any discomfort or pain, you can stop me at any time. Okay, and after that, we wash our hands, we put hygiene, and start by taking his vital signs, his temperature, blood pressure, heart rate, and respiratory rate. Okay, after that we expose the patient hand and his forearm, both of hands, so we can compare between them. Okay, and we start by inspecting. What's inspecting is basically we look at his hands. We don't touch, just look. We look for any swelling in his hands. We compare between both hands. Okay, we look for deformities. Some patients might have trauma to their hand. They have broken hand or something. They might have atrophy or wasting in their muscles. In these muscles, the thenar muscle and the hypothenar muscles, they become wasted because of the entrapment of the nerve. We are not using these muscles, so they atrophy. Okay, we also look for erythema, a redness in the skin. All of these things you compare between the two hands. Okay, after that you go for palpation. Before you start palpation, you take permission of the patient. You tell them, now I'm going to palpate your hand. Do you allow me to do that? And then you ask if he have any pain in his hands. If so, you start away from the pain and proceed toward it. Okay, now palpation, we have the soft touch. The soft touch, light touch, which is based on 10 out of 10 test. You ask the patient to close his eyes and you start here. You touch him in this area, either with your hand or a tissue, anything soft. You tell him, do you feel this? He will tell you yes. You tell him, okay, that's 10 out of 10, okay? And now you go to where median nerve distributes. It distributes to the thumb, to the index, to the middle finger, and on this side, radial half of the ring finger, only this half. Okay, so you start sensation. You tell him, do you feel this? He will say yes. You ask him how much out of 10. And on each finger you do that, and also on the other hand, so you compare. After that, we do the 2-point discrimination. You need two needles. You need two needles for this. You put the needle on the tip of the fingers, on the same finger, okay? And you ask him, what do you feel? he will tell you, I feel two objects or one object. That's how it's a differentiation, okay? And after that, you check for pain. After that, you check for pain. You with the needle, you press on the fingers, tip of the fingers, but you don't, it's just a simple pressure, not hurting him so much. Okay, after now you've finished with the sensory, you go to the motor function. You ask the patient to put his thumb on the base of your fifth finger, like this, okay? Of course, all this, you do it on both arms, okay? And if he can do it, you ask him, okay, now put it as far as you can. Okay, after that, you tell him to make his hand like this and point with the thumb to the ceiling, just like that. And then you tell him, okay, now I'm gonna put a pressure on your finger and I want you to resist me. Okay, so that's how you measure the power of the muscle. If he can't resist you, that's a 0. If he resists you good, without any pain, that's a 5. And in between, there is a scale. After that, we have some special maneuvers. We have some special maneuvers like the talent test and the Fallon test. We start with the talent test. It's basically you support his hand. Okay. You support his hand on your hand like that. With the other hand, you press on the carpal tunnel like this. Okay, you press for 60 seconds. You press for 60 seconds or until the patient feel a pain in his hand, or he tells you, I feel like an electrical shock in my hand, okay? And then you stop. That's a positive test. If he doesn't feel anything, you go one step further. You do the Fallon test, or reverse prayer sign. You ask him to do like that for 60 seconds as well. He should feel numbness on his thumb, index, middle finger, and the radial part of the ring finger as well. But some doctors don't like this test like this because you are putting stress on your elbow and on your shoulder. So what they said, okay, we can do it like this. They make the hand, wait. Okay, they make the hand flex like that, and they put a pressure on the carpal tunnel, okay, for 60 seconds. And the patient should feel some numbness and tingling sensation. Okay, and by that, you finish the median nerve examination. But you have to rule out other nerves like ulnar nerve and the radial nerve. This area here for the radial. Hello? Yeah. This area here for the radial nerve, the ulnar nerve, and on this side is the radial nerve. You tap on it, just like the talent test on the median. And that's it for the carpal tunnel. You can, for needles, you can use the end of this is the hammer. Everyone knows it. On the end, on the distal side, you have the needle on here. You can use it as for pain or discrimination, 2-point discrimination. I hope it was useful for you. And if you have any question, you can ask me. Of course, after you finish with the patient, you cover him up. You cover whatever you moved, you put back. And that's it. Thank you.
Thank you very much, Dr. Siraj. It was fantastic. Before we open the floor for students to ask questions, I wanted to ask you, what advice would you give? One advice to our future medical students based on your experience as a great medical student yourself.
I would advise them to always take the extra mile, do better, and that's all you need. It's not that hard, but it's at the beginning it might feel hard, but then you can become used to it. Actually, it's just a process. I'm sure everyone will finish and succeed, and that's it. Thank you.
So any of our students want to ask Dr. Siraj a question?